So today we're going to be discussing hypertension. So hypertension is an elevation in blood pressure that is greater than 120/80, but is consistently greater than 140/90. And that's typically done on two different occasions that are at least 2 weeks apart, just to verify that it is a actual hypertension and not just a situational hypertension. Your ideal blood pressure is between 100/60 and 119/79. Variations are normal, but like I said, classic hypertension is that 140/90 on multiple occasions and multiple different periods throughout the day. Hypertension is typically caused by like obesity, smoking, stress. Genetics can even cause hypertension. It's often like a family thing, so you should know your family history as well, just to make sure that's not something that is you need to try to prevent. Secondary causes, renal disease can cause hypertension because of additional fluid, because your kidneys aren't functioning properly. Medications can cause some hypertension depending on the different type of med that they are. Pheochromocytomia can also cause it. Pheochromocytoma, medication to treat hypertension. ACE inhibitors, diuretics, beta-adrenergic blockers, calcium blockers, and those work by decreasing blood volume, decreasing cardiac output, and decreasing peripheral resistance. So diuretics are what typically will decrease your blood volume because it will force extra fluid out, therefore reducing the volume that is in your body, causing the blood pressure to drop. Peripheral resistance is going to cause the blood vessels to enlarge, so it reduces the pressure within the vessels themselves. So when we're assessing our patients for hypertension, some of the common complaints: headaches, dizziness, blurred vision, syncopal episodes where they black out, fatigue, chest pain. Those are all very common symptoms with hypertension. You're going to do EKGs just to check for cardiac symptoms as well, because hypertension can lead to other cardiac symptoms. So we want to make sure that we rule out any additional cardiac involvement and that make sure it's just the blood pressure issue and nothing more severe. If there is, the providers will often check for retinal damage, because severe hypertension will cause damage to the retinas and the blood flow in the retinas. So they can check for that damage to see how severe the hypertension is. So when we're talking to our patients about hypertension, we want to encourage them, if they do smoke, to quit, because that does increase hypertension and hypertension risks. Overweight patients will discuss with them like changes they can make in their diet, exercise programs so they can go through to help reduce weight, because that in and of itself could solve their hypertension. Patients are recommended to exercise 30 to 45 minutes 3 to 5 times a week, just to increase their activity levels, which will also help reduce their blood pressures. Reduction in alcohol and sodium can also help. Reducing stress levels. So any severe stressors kind of help them figure out ways to deal with it, and that can help them reduce their hypertension as well. Productive sleep cycles and consistent sleep cycles of 7 to 10 hours a night can help, or 7 to 8 typically, can help them with the hypertension as well. So that's what we would recommend to our patient. So our main outcomes that we're looking for is just long-term control of our blood pressures, and we typically like the goal of 120/80 is the ideal blood pressure, of less than 120/80. And that would be all.